Hello, this is Smita Kumar, and you're watching Medicircle. Today, on our healthcare startup series, we have Dr. Vishesh Kasliwal with us. He is the co founder and CEO of Medyseva. It is an Indore based healthcare startup focusing on telemedicine in rural India. Now, that's something very interesting because we have got a startup here today who's focusing on the real Bharat. That's good to know. It seems to become the ultimate healthcare partner of all citizens that they can get access to high quality healthcare services with ease at most importantly at affordable prices. Hi, Dr. Vishesh. Welcome to Medicircle Healthcare Startup Series.
Thank you so much, Smita. Thanks for having me over here. Thank you so much.
It's a privilege here, and as there are very few startups today who are actually focusing only the real Bharat or the rural India, where 60 to 70, I mean 70% population,
Yeah,
68.84 to be very precise, is
yeah,
so definitely if something is being offered, keeping in mind the rural population, it should be promoted, and that is what we are doing with Medicircle as a dedicated healthcare media platform for all such healthcare startups who are focusing on rural population on an all any such service or any such offering which is making the healthcare process easier, faster, and most importantly available to each and every citizen of India. So as the co-founder of Mediseva, tell us more about your telemedicine startup, when you started, and the reasons behind it.
yeah. So thanks once again, Smita. So let me start what actually is Mediseva. So basically, Mediseva, as you told, it's a rural telemedicine platform. So what we do is that we are opening multiple physical clinics across villages, wherein the patient walks into the clinic and they get a consultation either from an MBBS doctor or a specialist doctor over a video line and at a very affordable rates. So this is a basic concept what we are trying to do. So we realize that the people in the rural places do not have access to good quality doctors. The doctors present over there are either underqualified or non-qualified, and even if they want to travel to a city to get the treatment done, they end up spending a lot of money in traveling, lodging, fooding, boarding, etc. So that was the reason that we thought that we should do something for the people who actually need it. So we came up with this idea. Me and my wife, we both are the founders of the company. So during the time of COVID, actually, I was giving multiple consultation to people over a video line. So that was the time that this idea popped in, that there is something to be done for these people, and all this started then.
That's
So yes,
like about 75% of India's population that lives in rural villages need doctors who are based out of metro cities. About 620 million rural Indians need access to the basic healthcare facilities. Also, if we talk about the doctor-patient ratio, which is quite abysmal here in India, there
yeah,
is one doctor per 1,457 Indian citizens. While in the rural areas around, the ratio is as low as one
more,
doctor per 25,000 citizens. So we definitely see a
right.
huge gap between the healthcare seekers and the healthcare providers. Tell us, Dr. Vishesh, what are the important USPs of Mediseva as a telemedicine startup? Because we have such similar startups in telemedicine healthcare segment
Yeah.
like Meta 16 Labs and Ramin Healthcare, who are also providing healthcare services to rural India.
So, if I talk about what is unique about us, so I wouldn't want to say that we are something different and we are doing something great and nobody else can do this. This is not fact. Being a doctor and being working in the rural area, I would say that if even 20 more people come in this line, uh, uh, it is so much required in the country that I would actually want more and more people to come into this field. There are certain reasons. I know there are multiple challenges to work in the rural area. That is the reason most of the people do not want to enter this arena. So maybe take it as a challenge, and they should come into this focus area, and they should work. And everybody, if collaboratively work together, we can make the country onto a different arena altogether. And coming to something unique to us, so actually, I would love to say that we are actually following a Uber kind of model. So what exactly we do is that whenever the patient comes in, he doesn't have to wait. So, for example, if a patient say that I need an MBBS doctor consultation, so just a person who is manning the center presses of a button, And all the MBBS doctor who are there in the platform gets a push notification over their mobile application. Whosoever is free will take up the patient then and there itself. The patient doesn't have to wait. The doctor doesn't have to give any particular time. In case of a specialist doctor, we have a concept of an assistant doctor. So this assistant doctor either could be a physiotherapist, homeopathy doctor, or an Ayurvedic doctor. The person who mans the center gives a call to these doctors, which happens through an internet call only. They take the complete history of the patient, the detailed history of the patient to understand what is the actual problem the patient is facing. Because even the urban patient doesn't know that if I'm having an abdominal pain, what doctor should should I have to take the consultation from? So, and in the rural cases, it is totally zero. So, these junior doctors, or I should say, assistant doctor, takes the complete history. They analyze that which facility the patient needs consultation from, and similarly, they press up a button. For example, the patient needs an orthopedic consult. All the orthopedicians would get a notification on their mobile phone. Whosoever is free will take up the patient. So in this case, the specialist doctor doesn't have to put lot amount of time with the patient. They are busy people. They are like really, really busy. They have to cater so many people altogether. So this is how we are different from others. And another thing which we have is a device wherein on a touch of a finger, all your body vitals are being recorded. So including blood pressure, temperature, SpO2, respiratory rate, everything is being recorded just on the touch of a finger. You don't even need a cuff to measure the blood pressure.
Just like Mediseva is trying to solve one problem, which is availability of trained medical professionals, experienced medical professionals to offer medical help to these rural population. How is it actually solving the problem of affordability? Because is the business model easier for them? Is it very tough on their pockets to get a video consultation from an expert?
So we are giving MBBS doctor consultation from 50 rupees for any kind of specialty, whether it is neurology, nephrology, cardiology, and even I'm talking about the super specialty as well. We charge only 500 rupees. So if these doctors are actually charging, even if I want to get to an onco surgeon, the rates are fixed. It is 500 rupees. If I'm
So
going
how
to a
is
city
that
to get
gap
this
being
treatment
maintained,
from these people,
Dr. Vishal? How is that gap being maintained? Because the medical professionals are getting 3x or something more than that for each such consultation. So,
yeah.
what is the business model of medicine?
So obviously, out of this 150 rupee, 50 rupees or 500 rupees, we have certain share with Medicircle as well. But our objective is to get into nook and corner of the country. We want to establish Medicircle kendras at each and every corner. We are working on the volumes to start at. Second, we are even doing pathological investigations at the center. We have tied up with multiple hospitals, with multiple radiology labs. So when required, we send the patient to the hospitals, or the laboratory person comes to the Mediseva Kendra and collects the sample, and we get the report printed over there itself. So we are charging service charge on all these services as well. So the consultation is one part, but the consultation is a primary revenue source. But pathology, radiology, hospitalization, ambulance services, these are our secondary revenue sources.
Okay.
So this is what we are doing. Yeah.
And so, tell us how many lives you have touched so far, and are you available in all the remote locations of India?
So currently we are located in more than 50 villages. We are present in Madhya Pradesh, Assam, UP, Bihar, Jharkhand, Maharashtra, and Orissa. For now, we are expanding across India. By 15th of November, our first few clinics would be started in Nepal as well. We have already given consultations to more than 20,000 patients till date. Along with it, we have done multiple awareness sessions in schools, colleges, where we have given details, or we have discussed with students about multiple objectives like even COVID and menstrual hygiene and many other topics. So, covering that, we have given awareness session to more than 1 lakh students. So, this is what we have done till date.
And as you have also raised funds, you're not bootstrapped. I guess you have
Yeah.
recently raised funds, 1.5 CR in pre-series round under Startup India Seed Fund Scheme from AIC R&T Bhopal. So, how were these funds being utilized?
Yeah. So actually, I have raised around 35 lakh rupees from AIC RNTU, and 1.15 CR I have raised from a show known as Horses Table.
Okay.
So we were selected in this show known as Horses Table. From there, we have raised from five VC funds, and the show was telecasted on Aaj Tak. Mr. Vivek Bindra is also one of our investors in this pre-series round.
Okay.
The show is produced by Mr. Sunil Shetty. It's a Sunil Shetty production. So talking about where we are utilizing these funds. So one, as I told that I want to expand across India, we have reduced down the cost of patient consultation for now a lot. We used to take 150 rupees. Now we have come to 50 rupees. So that is a major thing which we have done. The majority of the portion is being used in technology enhancement. Many things are to be done in the technology base. We want more streamlined and a more effective way of consultation for the patients. So we are working in the technology at a very fast pace. So, and definitely operations, the sales team, the marketing. So that is where we are expanding a lot.
And what are your revenues in FY 2022 and what you're planning to close in this year, FY 2023?
We are by 23 we'll be able to close around 35 lakh rupees in this fiscal year we'll be making.
Okay, great. And what are your
Yeah,
future goals and expansion plans as you are already there in 50 remote villages? But definitely you need to
yeah,
expand more, and for this you need another
yeah,
round of fundings because scaling up
yeah,
definitely requires more and more funds. So, what are your plans?
exactly. So our plan is that by end of 5 years, when we complete 5 years, we want our presence to be there in more than 50,000 villages in India. We have already moved on in Nepal. Soon we'll be present in Bangladesh, Burma, Bhutan, and some African countries like Zimbabwe, Zambia, Namibia, and Kenya. So we've already started discussing things out in these many countries. So the plan is to get into the African region, the Indian subcontinent, and the Southeast Asia. So this is the scope where we want to expand ourselves, and then eventually would want to get into the urban sector. That maybe after 3 years down the line, when I'm able to cover substantial amount of rural part, then we are planning to get into the townships, the hostels. So this is the way we are actually going ahead.
Great. And any learning that you would like to share, which you gained during your entrepreneurial journey?
Oh, lot many. Every day every day
Yes,
I'm learning
practically.
something new. I'm a medical doctor by qualification, so getting from the healthcare to entrepreneurship is a different, altogether different game. And running a startup is totally different, because running a pedica business is one thing, but running a startup has its own challenges. Um, One, to convince the biggest learning what I've learned is to convince the first customer, like, you, this is something different, you have to pay for this. That was one. Then convincing the first chunk of investors to
Yes.
bring that 35 lakh rupees. That was a big thing, how to do this, how to sell yourself. So learning how to sell yourself was a very big task. So, and every day learning so much about rural marketing, rural arena, because what we people live in the urban part. So the urban is totally different from the rural, we all know this, but it was that different that I didn't know. And when I started going and moving into these rural villages, I realized that this is a different ball game altogether. So it is fun, it is adventurous, and I feel that I'm blessed that I'm working in this area, so that I'm able to learn so much and understand about these people. Yeah,
That's good, and definitely if you're gaining experience, because when we talk about rural India, it's there are very few startups who are actually focusing only on the rural Bharat, and that is the need of the hour. We need to have more and more startups, and especially
yeah,
if we are having more and more doctors who would be giving their means experienced and eminent consultations to the patients who are living in the remotest places of India. Like if we talk about, I'll just share one figure here, Dr. Vishesh, that one out of these 700% doctor, only 75% 0.1% competent doctors actually practice in urban areas. So we have got a huge chunk of doctors who are only practicing in the urban areas. Now 23%
Very
of
true.
them in towns, like they practice in these semi-urban kind of areas, and
Hmm.
only 2% of doctors are are such doctors who are practicing in the rural areas. So from here we see that while the rural population is so much, the doctors who are practicing in these rural areas giving consultations to such patients is just a mere 2%. So that's a huge gap, and I think with
So,
startups
so
like yes, please.
I'll clarify this more. The 2% of the doctors are seeing 90 crore of the population, and 98% of the doctors are seeing only 50 crore of the population. So there is huge gap.
Yeah.
I'm just trying to resolve that problem, trying to making the bridge between the urban doctors and the rural patients. Yeah,
Yeah, definitely. You clarified it, because again we need to have more and more startups like Mediseva who are trying to bridge
yeah,
this gap, and so that even wherever the patient is, it doesn't matter rural, urban, or semi-urban, he or she should be getting a good consultation from a good doctor, experienced and eminent doctor, so that the cost is saved, most importantly, and the life is saved. Thank you so much,
yeah.
Dr. Vishesh, for joining us today on this Medicircle Healthcare Startup Series. We wish you and Mediseva all the best for all its future endeavors.
Thank you so much, Smita. Thank you so much for having me over here. Thanks.